Hi, my name is Chris. A few years ago, I fell in my bathroom and I fell into the shower, and I hit my head and I injured my spinal cord. When I had my accident, I ended up at Toronto Western Hospital, and they immediately admitted me for surgery, decompression surgery on my spinal cord. And I think that was about an 8-hour surgery, and from there I ended up in ICU. I was in ICU approximately 5 months, and then from ICU I was admitted to inpatient, where I was there for about another 5 months as well, and from there I ended up at Lyndhurst, and I was there for approximately 4.5 months. My internal perspective surrounding my recovery was always that I would pull through this, and that was strengthened just by the professionalism of the doctors, the nurses, the staff. While I was in ICU, I never feared for my life. I never thought I was going to die. I was confident that things would get better. It seemed to take a long time, but for the most part, I felt pretty calm that the staff and the doctors were doing their best to take care of me, and I was going to pull out of this. Some complications after my surgery included pneumonia. I rejected a blood transfusion, a heart attack. Due to some of the medications, I was hallucinating and started seeing different images in the ceiling and around me. I was heavily medicated for most of the time in the ICU, so it's difficult for me to assess exactly what the staff was doing around me. I was on a ventilator for most of the part of my stay there, and that was a long process to slowly get me to wean off the respirator, and I was seen by the respiratory team. My family was a huge part of my recovery. I was fortunate enough to have them there pretty much all day and all night. They were on rotation and even helping me with entertainment. But I could totally understand how somebody who doesn't have that support system could benefit from the nurse keeping them engaged in either conversation or providing a radio, movies, or any other type of entertainment or engagement for that patient. Because of the level of medications that I was on, my family was mostly in communication with the doctors regarding my care, so they worked very closely with them. If I could change 3 things in my care, it would have been communication, patient education, and consistency. I had a trach, and that was one of my biggest frustrations, was trying to communicate with family, with staff, with clinicians. I had a communication board, which I could write and point out letters and spell out words, which was a great tool in helping me reduce some of my anxiety surrounding communication and what I was feeling and what I was going through. I felt that I was out of the loop in terms of what possible side effects and complications could arise from the medications I was taking. And my family was in closer communication with the hospital staff. And I was left to have my family explain to me that the reason I was hallucinating or seeing things in the ceiling was because of the medication, and I wasn't aware that I would be having these kinds of side effects. I didn't understand how important it was for me to push myself on the wean machine. Only looking back on it now, realizing that it was in fact an exercise to help regain the strength of my respiratory system. I wish I would have been given that information, not only at the beginning of it, but during and as I was going through it, each and every day reminded the importance of it, to fully understand that this was a necessity in rebuilding my respiratory system. Some of the things that I really appreciated and worked well for me in terms of nursing care were the nurses that actually took the time to ask me about things about who I was, what I did before my accident. The nursing for me that really stood out were the nurses that were more consistently with me. There was a high level of turnover in terms of care, who was actually seeing me, but the nurses that were there regularly and built a rapport with me seemed to quiet my anxiety and make me feel more at ease the best. When new nurses came in to do my care, the ones that asked me my name, asked me how my day was going, and took a few minutes to get to know me, and then explained to me who they were and what they were going to do and where they came from, really helped my comfort level and my anxiety. But the ones that talked me through it and explained the reason that they need to suction me 3 times as opposed to 1 time was because I was having different levels of secretions or different thicknesses. But the ones that walked me through it always and communicated what they were doing really alleviated the anxiety and helped me feel more comfortable. The 2 most personal and I guess evasive procedures was being suctioned and the intermittent catheterization. The nurses that took the time to communicate with me and get to know me are really the ones that mattered the most and are really the ones that gave me hope. I think the nurses that really pushed me to be up in my chair and got me to get outside and reintegrate slowly into the outside world were really beneficial to progressing my care, my health. I wish I had advocated more strongly for myself for OT and PT services. I felt it would have helped me progress my mobility a lot sooner and a lot more quickly. I think the nurses could have been more consistent in helping me with OT and PT and not just leave it strictly to scheduling if it works out for me to be able to have these services or not. It doesn't even have to be a long-winded conversation. It could just be a few small things like, hey Chris, have you gotten up in your chair today? Hey Chris, have you tried your hand grip strength today? Hey Chris, have you tried using your triceps and touching your top of your head? Just small little words of encouragement that I could keep in the back of my mind and thinking about. I understand the importance of pain medication due to the condition that I was in. Because I had so much respect for the clinicians and the people taking care of me, whenever I was asked if I wanted painkillers, I felt I needed to say yes, but had we had more communication about my medications, I could have made a more informed decision about what I needed and how much I needed. I was lucky enough not to have any skin issues while I was in the ICU. The staff was great at turning me at regular intervals. Close to my discharge from hospital, I developed the early signs of a pressure sore, which I was told to apply a light dressing to. This eventually turned into a full-blown pressure ulcer, and I ended up in hospital for 7 days and in bed for 10 months on my side, being turned every 2 hours. Had I been empowered with the information and the importance of skincare and being turned and the complications that it could lead to, I felt I would have been more diligent and this whole entire ordeal could have been avoided. Some of the things that I'm working on after my accident now is obviously I'm involved with patients and partners. I've started my own company called Handy Help, which consults to help smart enable your home environment so you can control things through your phone or through your voice. I participate in swimming. I do some physio where I stand up and walk in a local mat machine. I've also built and led an accessible yoga class with a friend. And I try to advocate as much possible to show people that you can have a quality of life and there's a lot of hope and a lot of positive and brightness in the future regardless of your injury.